Have you ever experienced swelling in your legs? Or maybe you've noticed pain or warmth in one of your limbs and wondered what could be causing it? You might be dealing with something called deep vein thrombosis, or DVT. But what exactly is DVT? In this video, we'll break it down for you, explaining what causes it, the symptoms you should look out for, and how it's treated. Let's get started. What is deep vein thrombosis, DVT? DVT occurs when a blood clot forms in one of the deep veins of the body, most commonly in the legs. While DVT can cause pain and swelling, sometimes there are no symptoms. The clot can be dangerous if it breaks loose and travels to the lungs, causing pulmonary embolism, PE, which can be life-threatening. Research shows the highest risk for PE occurs within 6 weeks of DVT development. Early treatment can reduce this risk. What causes DVT? There are several factors that can increase your risk of DVT. Genetic conditions that affect blood clotting are a major risk factor. Other conditions like cancer and treatments like chemotherapy can also increase the likelihood of developing DVT. Prolonged hospitalization or staying in bed for a long time after surgery can also trigger DVT. When you're lying still for extended periods, especially during recovery, blood flow slows down in the legs, which can lead to clot formation. Long periods of immobility, like sitting for long hours during travel, after surgery, or due to injury, can reduce blood flow and lead to clot formation. DVT is more common in people over 40, but anyone can develop it. Pregnancy, obesity, and the use of oral contraceptives or hormone therapy also increase the risk. Inactivity, smoking, or having a central venous catheter can also be contributing factors. DVT symptoms. How can you tell if you have it? Many people with DVT don't experience symptoms. However, common signs include swelling, pain, or tenderness in the leg, particularly around the foot, ankle, or calf. The skin may feel warmer and look red or bluish. If the clot forms in the arm, you might experience neck pain, shoulder stiffness, or swelling in the arm. You might not know you have DVT until it causes a pulmonary embolism. Symptoms of PE include chest pain, shortness of breath, and dizziness, which require immediate medical attention. How is DVT treated? If you're diagnosed with DVT, doctors focus on preventing the blood clot from growing, breaking loose, or traveling to the lungs. Treatment options vary depending on the severity of the condition. Anticoagulants, also known as blood thinners, are the most common treatment for DVT. These medications help reduce the blood's ability to clot, preventing new clots from forming. You may need to take them for several months, depending on the severity of the clot. If the clot is large or causing severe symptoms, thrombolytic drugs may be prescribed. These drugs help dissolve the clot, but they come with risks such as severe bleeding. For people who cannot take anticoagulants or who don't respond well to them, a doctor may recommend an inferior vena cava (IVC) filter. This filter is inserted into the largest vein in the body, the inferior vena cava, to catch clots before they can reach the lungs. Compression stockings are another effective treatment. These specially designed stockings help improve blood flow by applying pressure to the legs. They can help prevent blood from pooling and reduce swelling. Complications of DVT. If left untreated, DVT can lead to severe complications, most notably pulmonary embolism, PE. Pulmonary embolism occurs when a clot breaks free from the leg and travels to the lungs, blocking blood flow. This can be life-threatening and requires immediate medical care. Another complication is postphlebitic syndrome, which occurs when the blood clot damages the veins, causing pain, swelling, and skin discoloration. In some cases, anticoagulant medications can lead to bleeding, so doctors carefully monitor patients who are taking these drugs. How to prevent DVT. You can take steps to reduce your risk of developing DVT, especially if you're traveling or recovering from surgery. The CDC recommends staying active and moving your legs frequently during long flights or car rides. If you have to sit for long periods, make sure to get up and stretch your legs every couple of hours. Hydration is key. Drinking plenty of water helps keep blood flowing smoothly and prevents clotting. If you are traveling, wearing compression stockings can also help improve blood circulation and reduce the risk of clot formation. Maintaining a healthy weight, staying active, and quitting smoking can also lower your risk of DVT. If you're pregnant or on birth control, be sure to discuss your risk with your doctor. They may recommend additional precautions to protect against DVT. Prognosis: what to expect. Most people with DVT recover well with proper treatment. Blood thinners are effective in preventing clot growth and reducing the risk of pulmonary embolism. However, regular checkups and blood tests are essential to ensure the medication is working as intended. For those at higher risk, such as travelers or people who are recovering from surgery, wearing compression stockings and staying active can help prevent the formation of clots. If you have had DVT in the past, you may need to continue taking blood thinners for a period or take them before long flights. Deep vein thrombosis is a serious condition, but it can be managed with early detection and proper treatment. By staying active, hydrated, and taking preventive measures, you can reduce your risk. If you notice symptoms like swelling or pain in your legs, seek medical attention right away. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Stay active, stay healthy, and take care of your body.